Complications of rhinoplasty. Rhinoplasty or nose job is a very complicated procedure. It has a revision rate of anywhere from 10 to 20%, even in the best of hands. Some consider it to be the most difficult plastic surgery procedure. And it's not because of the technique of the surgeons as much as it is the healing process as well. Because the healing process on soft tissue during the healing develops scar tissue, which pulls on different areas, changes the shape of the nose, which might look perfect right after surgery, but with time becomes crooked. So let's go over some of the complications. They are functional and cosmetic. Let's go over the functional first. It can lead to nasal septal perforation, which is a hole in the nasal septum. It can cause obstruction of the nose, difficulty breathing because of changes in the cartilages. That can be temporary, minor, or it can be major or permanent. It can be fixed, however, in majority of the cases. There can be, in rare cases, and I repeat, rare, trauma to the bones of the nose leading to the trauma to the base of skull with leakage of CSF fluid leading to meningitis. There can be trauma to the tear duct, which clogs up, and then you start having a lot of tearing of the eyes. In rare cases, you can have loss of sense of smell, which can be permanent. Those are the main things that happen functionally speaking in terms of the function of the nose, which is smell and breathing. Let's get to the cosmetic part. Cosmetically, you could have a suboptimal outcome and hence the revision surgery. You can have what's called a saddle nose deformity, where the nose becomes like a saddle. It becomes really depressed all along. You can have an inverted V deformity, which basically shows you the markings of your nasal bones, because the upper lateral cartilages have sunken in and you can see the boundary of the bones, inverted V. You can have an open roof deformity where it looks like this area, which is now flat like a runway, and you can see the nasal bones because the nasal bones were not brought together, and this is all broad, like an open roof or a runway. You can even see the edges of the bones. You can have a polybeak deformity that happens from swelling, edema, and later on scarring in the nasal tip area where it looks like a beak of a parrot. It doesn't look very pointy, but just swollen and leaning over. You can have irregularities of the nasal rim, the rim of the nostrils, and difference in the shape of the nostrils as well. In rare cases, you can develop also loss of skin. It is more common in revision surgery though. And all of these complications, unfortunately, can happen in the best of hands. They can be change in color of the skin as well. Sometimes there's an acne breakout afterwards that's temporary and usually goes away. There can be irregularities of skin, soft tissue, or the bone. So as you can see that this is fraught with a lot of complications, and that's why it's a very delicate procedure. Thank you for watching the video. I hope you liked it. I love doing these videos and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.